am honored to be with you all this morning and to have you join us for our 21st annual Day of Service and Reflection.
When we did this for the 75th anniversary, this would have been 2003, we had 30 people and 3 sites. Today, we had over 200 registrants across the medical center.
It feels to me like one living manifestation about how we are better together and how we're here to make a difference.
Olive Branch Mission, as you know, serve an abundance, every population of unhoused individuals, to have a painting space done for our single men, for their area, for their community area. To have a beautification project outside to be done all in one day by volunteers, it means a lot.
We are our community. I don't see it as a us and them. To be engaged with who we are, with our community, is at the core of what we need to do.
I feel Dosar is really important to UChicago Medicine in our community because it's our chance to give back on a single day where the whole community comes together.
We know that we have diversity of thought if we bring different groups together, and we are all trying to solve some of the same problems, and so we shouldn't be working alone.
It's a reflection of our commitment to the well-being of the community, and it's not just always about patient care, but it's about caring for people outside of the walls of the hospital.
Dosar is an opportunity for us to give back to the community that is so important to the University of Chicago Medicine. The thing that really matters is the opportunity to really work in the community because they are part of us. And it also, days like today, allow us to give back, but also see things that we wouldn't see otherwise, to begin to really understand our community. No matter where you go on the south side of Chicago, you are going to get good health care, and we're going to improve access.
We're in a community garden, and we have been weeding, clearing the fences, growing new plants, and really trying to help them get this space ready for the season. And I take a holistic or an expansive view of health. So on the small micro level, it's what do we do in the hospital every day? But health is much bigger than that. How do we ensure there are places where kids can get food? How do we ensure there are places where people are able to exercise? And this allows us to give back to healthcare in truly the most expansive definition of the word.
If it weren't for volunteers like those that are here today from UChicago Medicine, we could not exist. We really require volunteers to stay in existence. And so we're really just overly appreciative when folks come out to give us a hand.
We know it's important work, and we know that these communities here on the south side are very important to us, to UChicago, and so it was just, I just feel like inspired and so happy I got to be a part of that feeling too today.
I want to thank everybody for spending their Saturday together with us and serving the south side. We are part of this community. I think it shows they're so important to us and we're so important to them, and I think getting out there in the community and making a difference really matters. So thank you very much for being here.